Friends, Dr. Motley here of drmotley.com, and it's been a long week. I haven't reached out because we've been doing a lot here at the tea room, and it has been busy, starting to get things wrapped up, but I wanted to give you a shout out before the weekend because I missed y'all. Today, I wanted to talk about what I've been seeing in the office, which is patients feeling stuck. Do you feel stuck? Especially emotionally. Patients feel like they could progress, they could go forward, but they say, I know there's an emotional block somewhere that's keeping me from what? Feeling better. And the reason why is because physical problems can come from emotional setbacks, from emotional traumas. And when you have traumas that are trapped in the body, they get stored in the brain. And the brain, remember, is a map of the body. So you can store a trauma somewhere around anywhere in the brain, and it can present itself physically in a certain portion of the body. Now, if you can't go forward, is there any way that you and I can get an indication if there's trauma that I'm not really aware of to bring it to the surface so that I can go process it? Yes, there is. Some people say, I don't even know what I feel. I don't even know what's going on inside. Well, then this is the perfect post for you because I've been experiencing this and I think it's a great technique. I love different Chinese medicine techniques with acupressure and acupuncture like NET, which is neuroemotional technique, EFT we talked about before, NMT, neuromodulation technique. There's so many out there. They all work really well. But I'm talking today about EMDR and brain spotting. And they use the eyes. The eyes are a window to the soul, and there are basically good evidence that the eyes are actual windows to the soul. And here's why, because when you're developing in the womb as an embryo, the eyes are the first organs that form off of the brain. There is a large connection and link of neurology, nervous system, nerves, meninges, all going through these organs and connecting them to where they become a map of each other. So you can look at what's going on in the eyes and it can give you a representation of what's going on in the brain. There's still a lot of research out there, guys. Check it out. It's very interesting. But EMDR and brain spotting use your eye movement as an indication or an alert system to what's going on in your brain. So what a practitioner will do is have you follow an object with your eyes, and if you at some point stop or your eye movement stops or slows down, or if you have a change in your heart rate or your breathing pattern, that's an autonomic nervous system response. You don't even know it happened when your eyes went to a certain position. But why? Maybe at some point in the past, when you recorded a trauma in your brain, your eyes were in a certain position when you experienced it. Your body was breathing a certain way. Your heart rate responded. Your body keeps a score. There's great books out there called The Body Keeps a Score or Waking the Tiger. Check those books out. And when you record this trauma and your body puts that eye in that position, you don't even know that when you move your eye in that position that all those things are happening, but you have to become sensitive to it. So the practitioner asks you, do you feel a change in your breathing? And you will. And what happens is, then you dig in and they say, what comes up to your mind? Any thought, anything comes to your brain. What is the thought? Oh, I had a happy experience with my father when I was 7 years old, or 14, I had the worst experience with one of my best friends. There is a recorded trauma when you had your eyes in that position, and then you allow that to process through. Allow the energy and allow the focus to allow that to pull through, become aware of it, and then see where it leads. And at some point, you'll start to feel your heart rate lessen and your breathing normalize. That's your body becoming aware of it so you can process it. And so you go through different movements, and you go through it enough times to where you start to normalize and your eyes move nice and smooth. You'll find out that some of these traumas, even in dreams or the next few days, you'll probably process or detox even physically. And you actually may feel pains or twinges in areas of your body where you stored that trauma. So remember, eyes are your window. They're a map of the brain. If you cannot become aware of a trauma, your body does not know how to go and process it. The point of this techniques, and there probably is so much more research, and I want all my friends out there that know more about this than I do to tell me, but when you become aware of it, then you can process it. And this is a great technique. So if you feel stuck and you want to try something that'll help unstick you and you don't know what is making you stick, try this out. It's a good technique. I hope you guys have a good weekend. Let's not feel stuck. I love y'all. See ya.